Whether you're chasing a sandy beach or fresh powder in the mountains, March is spring break season.
It's really important ahead of that travel to think about protecting yourself against measles. And that's particularly important right now because we know that a number of outbreaks are occurring.
Once considered an eliminated disease in the U.S., we're now seeing active outbreaks across the country, the worst in Texas, with more than 120 cases and 1 death. State epidemiologist Dr. Rachel Herlihy
First is that it is a highly contagious infection.
Is most worried about international travel, outbreak locations, and places where we've dropped below the threshold for herd immunity.
And we know those communities are particularly at risk of an outbreak.
These are CDPHE's recommendations. If you got the shot between 1957 and 1968, consider a booster.
That was not the same vaccine that we are using now, a less effective vaccine. And so there is a recommendation if you received that vaccine to receive the updated vaccine to make sure that you are protected.
If you got the shot between 1968 and 1989, likely 1 dose, no push for a booster right now.
So the good news is that 1 dose is highly protective. We estimate about 93% effectiveness associated with 1 dose.
Even better for folks vaccinated from 1989 until now. The MMR vaccine is 2 doses. And if you just can't remember...
So if you don't have access to your record, you're worried that perhaps you were not vaccinated, it is okay to go ahead and get a dose of the MMR vaccine. It's just not a routine recommendation.
So what about our oldest and our youngest population? So those recommendations, let's talk about those. If you were born before 1957, that was before routine vaccines in the US, health officials say you actually probably have measles immunity due to previous infection. You don't need the vaccine. And if you have little bitty babies, those guys haven't even really started their vaccine schedules yet, so that's a little bit of a different situation as well, Sam.
I have so many questions for you, and I'm so glad that you're doing this because I think a lot of us assume, like myself, that I would not need a booster, and I don't. I know that now.
Based on your age.
1980. What about, I'm thinking of my kids, a 4 and a 7-year-old. Yeah. If my son has had 1 of the shots but still needs 1 more, where does he fall in that?
So I asked about the little kiddos who are either prior to the first dose, so younger than 12 months, 12 months old.
Yep.
They're okay for the little babies about not getting a dose unless you're going to be doing international travel or you're going to be in one of those hotbed areas. That might be a recommendation for an early shot for those kiddos, but this is something where you talk to your pediatrician. Ask them about it, talk to them about your risks. Now for the kiddos who are between doses, because it's a 2-dose regimen now.
Correct.
No change to the schedule, same guidance. Just be thoughtful about travel, talk to your pediatrician, but it doesn't sound like in Colorado, outside of a hotbed area, that you would need to do extra doses for those kids.
And for those that needed a booster, are there doctors talking to them about that? Are they going to be aware of it?
The idea is no matter what, go to your doctor. Talk to your primary care physician about this, where you can get one, how you can get one, if you should get one. Because even people who aren't in the recommended area, like you and I are both 80s babies, we don't really need one. We've already had one. But like, what if you work in healthcare and you're exposed to potential measles? What if you're going to a hotbed area? That might escalate. So CDPHE is like, hey, just have a conversation.
Right. Talk to your doctor. They know what's best, and let's get this under control.
And if you get an extra one, and you might not necessarily need one, they said the risk of another dose is less than the risk of the virus. So let's just say you're like one of those folks like, let's just be extra careful. The state says that that's a better scenario than not having it and getting sick.
Correct, especially if you have an immunocompromised person at home. I think that's important as well. Jennifer Meckles.
Talk to your doctor.
Yes, thank you.